Good afternoon. I want to thank all of you for joining us today for the Certifying Exam webinar. We're really glad that you're here with us. This will be recorded and you will be able to view this after the session. I want to introduce to you Diane Gorgas. Diane is the president of the American Board of Emergency Medicine Board of Directors, and she is also the chair of the Certifying Exam Work Group. And Diane will be sharing with us this afternoon. And with that, I would like to turn this over to Diane.
Yeah, welcome everybody. We're glad that you're going to spend some time with us finding out about the certifying exam. Just to give us a little bit of framing next, in today's conversation, we're going to be talking about ABEM. We're going to be talking about your role within ABEM and the steps that need to be taken for you to become ABEM certified. We know that most of you are here to hear really detailed information on the certifying exam, so the bulk of our time will be spent there. And we're going to have a live Q&A session. Throughout the entirety of this presentation, the Q&A session will be open. So feel free to drop your questions in there as I move along, and hopefully we'll get to a number of them in the wrap-up of the session. Next. So first of all, what is ABEM? The American Board of Emergency Medicine, we certify emergency physicians who meet our educational, professional standing, and examination standards. ABEM certification is sought and earned by emergency physicians on a volunteer basis. The ABEM Board of Directors, 17 in all, members from across the country, we're physicians who are experts in emergency medicine. We have a diverse set of skills and backgrounds. We're from community medicine and from academic medicine. And we also have a public member who has expertise in family and patient engagement. Our mission fits on the back of a t-shirt. It is to ensure the highest standards in emergency medicine. And the purposes that really drive us forward in this are to improve the quality of emergency medical care by establishing and maintaining the highest standards of excellence in emergency medicine and its subspecialties. We're here to enhance emergency medicine education and related subspecialties, to evaluate physicians and promote professional development through initial and continuous certification in emergency medicine, and to certify physicians who have demonstrated special knowledge and skills in emergency medicine and its subspecialties. We're here to enhance the value of certification for ABEM diplomats to serve the public and the medical profession by reporting the certification status of ABEM diplomats. ABEM holds the interests of patients and their families in the highest standing, particularly with regard to the provision of the safest and highest quality emergency care. ABEM addresses its commitment to patients by supporting the physicians who provide care to the acutely ill and injured, and by working to transform the specialty of emergency medicine. Next slide. So how does ABEM fit into your career? All of you have bright futures. ABEM certification will be valuable to your career in patients, not the least of which is through added compensation, but also recognition as a specialist. It increases public and patient trust. It allows you to have broader and more rewarding practice opportunities, and gives you a sense of professional pride. So certification by ABEM is viewed as the gold standard for emergency physicians. It indicates you're a dedicated and independent practitioner to delivering high quality care, and have demonstrated that the skills and ongoing expertise needed to meet the highest professional credential in emergency medicine those are skills that you have. It also signals your commitment to staying up to date with the latest medical advances. Emergency physicians lead care in the emergency department. In any given moment in the emergency department, life hangs in the balance. An emergency department may have physician assistants, nurses, nurse practitioners, and other who all play important roles. But like 80% of the public, we believe physicians should lead emergency care. We look forward to working with you to achieve your ABEM certification as you move forward in the next steps of your emergency medicine career. Next slide. So let's talk about what that road looks like, your road to ABEM certification. Next. The purpose of initial certification is to objectively and independently confirm that physicians who complete an emergency medicine residency demonstrate core knowledge, skills, and abilities needed to practice emergency medicine at the highest standards. As you've heard, the steps to certification will be changing in 2026. The oral exam that has been part of ABEM history for the last 40+ years, while proven relevant, valid, and reliable, will be going away in 2025. In 2026, the next step for certification after passing the qualifying exam will be the new certifying exam. So these are the steps to ABEM certification as outlined on the slide. You will apply, you'll take the qualifying exam, you'll now take the certifying exam, and you'll become ABEM certified. But before we dive into the certifying exam, I want to make sure you understand the initial steps to certification. It is best not to delay certification. It's important that you apply in your last year of residency in April, the year that you're graduating. You take the qualifying exam that fall, and then the certifying exam the following year. ABEM will email application information to you in mid-April. Any resident graduating from a residency program in that year will receive a current application. This is done online through the portal, and it's important that you don't delay. Apply as soon as you receive the information from ABEM, and this will really help you avoid late fees. What does board eligible mean? Your program director will inform ABEM when you meet the training criteria necessary to be board eligible for certification. Board eligibility begins after your graduation date once your program director verifies you completed training. It expires 5 years later on December 31st of that final year. The application is not the same as qualifying exam registration. Submitting the application, registering for and scheduling a qualifying exam appointment can all happen in one step with the new electronic portal. You're required to pay fees before you schedule a qualifying exam. It's a $420 application fee and a $960 fee for the qualifying exam. You all are considered board eligible after you complete your training and ABEM gets sign off from your program director attestation. The qualifying exam, you are free to register for this between May 6th and October 9th of next year. It's a 1-week administration window between November 3rd and the 12th. And the qualifying exam is given at Pearson VUE testing centers. It is made up of a 305 multiple choice questioned test, and it is criterion referenced. And I'll mention this a few times in this talk. Criterion referenced means that there is not a curve and there is not an automatic passing score. Criterion referenced means that you should perform at the standard of a practicing emergency physician. We are very intent on getting scores out to you from the qualifying exam within 90 days of you taking the exam. And keep in mind that the in-training score can help you determine your projected qualifying exam score. So take those in-training test results seriously. Next slide. The pass rate for first-time test takers for the for the qualifying exam is 82%. The pass for all takers, the pass rate is 80%. This is lower than we saw in 2023, which was 88% and 86% respectively, but it does follow a multi-year trend. ABEM released the results of the 2024 qualifying exam on Monday, November 25th, and we recognize that failing the QE has a significant impact on physicians who will now need to retake the qualifying exam. We understand the downstream impacts of failing the exam this year. During the over 2 years of stakeholder feedback during the Becoming Certified initiative, ABEM heard from the specialty that maintaining high standards was of paramount importance. ABEM is committed to these high standards by maintaining the current standard for the qualifying exam, which again is criterion referenced to the practicing community of emergency physicians. It's important to note that the 2024 exam was not more difficult. The passing standard for the qualifying exam was criterion referenced in 2019, and since then, all subsequent exams have been psychometrically equated to this standard, which means that the exam difficulty has remained unchanged since 2019. But due to the magnitude of this year's decline, ABEM verified that this was a real decline in performance and not a function of a more difficult examination or other measurement issue. This year's qualifying exam performance results follow a 6-year trend of declining performance in both the in-training exam and the qualifying exam. We at ABEM are committed to working with the EM community to identify factors associated with the decline in examination performance. And we seek to answer questions and provide support on the next steps for all physicians in the certifying process. If you have other questions, you're encouraged to contact us at qualify@abem.org. Now that we've really set the stage for how to become certified, let's dive into the new certifying exam, which is why the majority of you are here. While the exam is new, the idea and building of the exam are not new. The certifying exam is an outcome of a multi-year initiative. Next steps. This initiative was called the Becoming Certified Initiative. It was made up of surveys, focus groups, interviews, a summit, and the findings all pointed to we needed innovation in our assessments. The assessment of the oral exam, while valid and reliable, needed to be expanded, and additional competencies needed to be considered. These competencies included simulation competencies like ultrasound and procedural skills, and also the opportunity to assess communication and interpersonal skills, teamwork, and a set of skills that's really central to the success of the future of emergency medicine. Next slide. As emergency medicine practice has changed, so must certification to meet these new demands. In emergency medicine, certification is more important than ever. It really differentiates between EM trained and non-EM trained physicians working in emergency departments, and also differentiates between physicians and non-physician providers. So the outcomes of the Becoming Certified initiative are really to maintain the highest standards, but to assess more than just medical knowledge, and to better assess the skills and competencies important to the specialty. We had to create an exam that is really more relevant to practice and is adaptable to changes in medicine, and is a truly meaningful assessment experience. Next slide. Which leads us to the certifying exam. It will be an in-person exam at a single testing center in Raleigh, North Carolina. It's a half-day in-person session that will be composed of 2 different case types: clinical care cases and communication and procedural cases. Next slide. The clinical care cases are facilitated by 1 or 2 examiners, and they will demonstrate how you as a candidate will prioritize patient care, Assess the adaptability to unexpected clinical changes, and see how you interact with various sources of information. In opposition to these, the communication and procedure cases really assess communication, professionalism, and essential technical skills necessary to care for patients. Next slide. The clinical care cases are each 15-minute cases. There will be 4 cases per exam session with 2 examiners in each room. And the content areas of the clinical care cases include clinical decision-making and prioritization. For clinical decision-making, think how you present cases to one of your faculty members, one of your boss doctors on shift. What elements of the history and physical exam are most important in these cases? What is your differential? What would your workup be of this patient? What is the disposition going to be? What treatment steps does this patient need? It gets behind your thought process of how you care for and treat patients that you do every single day. The prioritization clinical care case is different. Imagine walking into an emergency department on a busy evening shift, and there are 6 or 7 new patients to be seen. You'll be presented with a tracking board, and you'll be asked to prioritize patients on that tracking board, and what critical information do you need to help prioritize which patients you're going to see first and which treatments they may need. There may be interruptions during your prioritization cases. You'll be asked to triage multiple patients that may be arriving without warning. And you may have patients with multiple injuries. And during that session, there may be additional patients that come into the emergency department that you'll have to rapidly assess and integrate in your queue of workflow. The communication and procedural cases are different in that they're 10-minute cases, and there's going to be 6 cases per exam session. Each candidate will receive a procedure and an ultrasound case, and there will be an examiner in the room with you while you do those cases. We're also going to have a set of cases that have standardized patient actors. The content area where you'll be interacting with a standardized patient actor are reassessment and troubleshooting, difficult conversations, also I think of it as breaking bad news, managing conflict, and patient-centered communications. Those are all of the communication cases, and the procedure cases are ultrasound and critical procedures in emergency medicine. Next. Case development is an expansive and thorough process. Case development has been ongoing for about a year at least. There's an embedded video here, which I'm going to play for you, that's going to talk about who's developing the certifying exam.
My name is Kim Feldhaus, and I'm on the ABEM Board of Directors. And I want to talk to you today a little bit about who is here at the AIM Center in Raleigh helping to create the new certifying exam. We have a large and very diverse group of case developers that include early career physicians, it includes physicians who are in academic settings, it includes physicians who are in community settings, it includes physicians across the United States coming from different geographic locations, it includes public members, it includes standardized patients to help us create this very robust, energetic, and different certifying exam.
We also have public members that are taking part in case development. They're an important part of the exam process. They will not be used as scorers or evaluators for you, but it's important that we have the public member perspective as we're developing cases. This video is from Luis Mendoza, who is the director of the Washington State Fathers Network. Go ahead and play the video.
Hi, I'm Luis Mendoza, and I'm happy to have been asked to be a public member in the development of the new ABEM certifying exam. Specifically, I'm working with the team that is developing cases that will help evaluate candidates in the area of patient-centered communication. The importance of having public members as part of this patient-centered communication focus is reinforced for me every time I tell someone that I'm involved with this work. Their reactions range from what a great opportunity to this is so important to actually giving me a hug and saying thank you. There's no doubt in my mind that having public member input will not only benefit the cases that are developed, but long-term, I hope that the work will impact the confidence level of the general public so that if they need to go to an emergency room, they know that when they arrive, they will be listened to and heard.
ABEM really has a keen eye out towards bias and fairness in testing. It's important that you all know that all the staff, directors, and the exam writers have gone through bias training, and that each and every case has undergone bias review by a panel. We have experienced professional patient actors, which increase the reliability of the test, and the examiners are evaluated during the administration and scoring process for their accuracy and their fairness. The scoring and equating process really adjusts for any variance in a specific examiner's scoring stringency so that everybody gets a fair, reliable, and valid exam. Next slide. So why does ABEM have an in-person oral exam? ABEM has had an oral exam since May of 1980. Unfortunately, during COVID, we had to move to a virtual format. It's important that you all know that most American Board of Medical Specialties boards have an oral exam, and most have returned to in-person. The virtual exam is valid and reliable, but as we discovered through the Becoming Certified initiative, it doesn't evaluate enough. There were additional competencies that needed to be assessed for the future of the successful emergency physician, and this had to be done through a new exam. Next slide. So the new exam is going to take place at the AIM Center. It's a professional assessment center in Raleigh. It is not a simulation center. It's a location for many other boards to do their certification exams across medicine. Some of the benefits of the center is that it will allow us to offer more administrations throughout the year, which you as a candidate will benefit from greater scheduling flexibility. The center is able to configure its space to accommodate different case types and provide uniformity in administering cases to all the candidates. Next. So why Raleigh? Raleigh is a unique center across the nation, and we toured the nation literally from coast to coast to find alternative sites or duplicate sites or different sites for this, and there was no other site that came close to the capability and the quality of an examination we could offer besides Raleigh. Part of this is that it will improve your experience as a candidate. You'll be able to register at the candidate hotel, and a proctor will guide you through all of the logistics. All that you need to do is arrive at the hotel on an assigned day and time. In Raleigh, the AIM Center has an administrative infrastructure that has been developed and proven for other ABMS boards. We also have standardized experiences for all candidates that allow us to administer a fair and equitable exam. The standardized patients that we used are experienced and they're professional medical actors. It's important that you know that we have the support of the community behind us as well in Raleigh, and that we've forged a partnership locally in the event that emergency medical care is needed through Wake Emergency Physicians. Next slide. As I mentioned before, the AIM Center will allow us to have more scheduling flexibility for candidates, especially those candidates with some mitigating factors, like those that are undergoing active military deployment. those who may have religious observances which need to be considered. Any candidate that is pregnant or has family leave concerns, we can accommodate that. And those with fellowship commitments. We also have on-site American with Disability Acts accommodations for candidates with documented disability who complete an accommodation request. There are wellness rooms, including accommodations for nursing mothers. There will be altered schedules for nursing mothers. There's allowance for medical aids as needed in testing room, and there's quiet and meditation and prayer rooms for the candidate use as well. Next slide. Candidates will have input and the ability to request exam administrations and to share conflicts with us for any of those weeks that do not work for you. We know that some plans predate your preference and your ability to schedule for a certifying exam. Exam candidates, once anchored within a week, will be assigned to a half-day session during one or multiple exam administration windows throughout the year. We cannot accommodate all requests. With more exam sessions offered throughout the year, though, there will be an increase in the ability to accommodate differing schedules. Next. So this is the slide that I'd really love for you to snap a picture of that QR code, because on the ABEM website, we have sample case videos, we have scoring guidelines, we have case references, we have case summaries, and importantly for all of you, we have the sample case videos that are posted there. There is a sample case video for every type of case. What I'd love for you to focus on is kind of the general setup of the case, not the medical content per se, but the general setup of the case, which will illustrate that case for you. One sample case video is available for each of the 8 case types. Each case type will assess different competencies important to the specialty. Sample cases, as I mentioned, were created to demonstrate the flow and the mechanics of a case, but not to explicitly anchor to case content. The sample cases represent a typical case format using an average passing test taker. Videos also have accompanying case materials available. Take a look at the scoring information for each of these case types. It's going to be helpful to consider that when you're reviewing the videos. And the scoring information starts with each case type by a competent physician will be able to ... That will give you a clue to what is being scored and what is really being valued in each of the case types. Next slide. You all are clearly going to want to know how to prepare. And the answer, although a little bit tongue-in-cheek, is just really be the best emergency physician that you can. And that means seeking feedback by faculty. You're going to have to study differently for the certifying exam in the future. But our goal at ABEM is not to create a tougher examination that more candidates will fail. Instead, we want an exam that indicates what an emergency physician should be capable of doing before embarking on a career of independent practice while meeting the standards of the specialty. So this is broader skills. But if you have not had an opportunity in your training yet to have a seasoned emergency physician, one of your faculty members, one of your preceptors, listen to you break bad news, listen to you interview a patient, listen to you as you negotiate through conflict, observe you as you gather new information and maybe have a case that is taking a left turn. And how do you react to that? Then this is your opportunity to seek very specific feedback so that you get a sense that you are prepared to take the exam. Next. You have been preparing for this new exam since starting residency. The cases are really similar to conversations that you have with your attendings all the time about the patients that you see. Use the resources available though. This exam is going to be mock tested and evaluated multiple times prior to its administration and scoring to ensure that it's a fair, reliable, and valid exam. We have designed this specifically to be a more realistic exam with less artificiality and less gaming the system and trying to figure out what the test taking techniques are. This is an exam that you should be able to walk into wearing your scrubs with your tennis shoes on and feel like you are seeing cases in the emergency department. That's the sense of realism that we want behind it. I'd like you to take a look at this brief video that John Marshall specifically addressed. How do I prepare for the certifying exam?
Hi, this is John Marshall from the ABEM board. I'm here at the AIM Center in Raleigh, North Carolina. And some people have wondered how they're supposed to prepare for the new certifying exam. And really the best preparation for doing this exam is just seeing patients. What we're really looking to do here is have an experience that replicates the kind of stuff you do every single day on shift and you do very well. Definitely look at the materials on the website, review the great videos we have up there, review the information here, but most importantly, take care of some patients, practice your craft, and keep being the great doctor you are every day, and it'll be just fine.
Thanks, John. So here are 4 QR codes that I think are going to be really key to your success, at least your success in feeling comfortable when preparing for the exam and comfortable walking into the exam. There's a QR code for about the certifying exam, for the exam content, a separate one for exam scoring, and then additional resources, including references and citations from which we've drawn all of these best practices that we are evaluating. Next slide. So what's next? If you are graduating this coming year in 2025 or after you graduate, you'll be applying, you'll be taking the qualifying exam, and once you pass the qualifying exam, you'll be taking the new certifying exam. We are in the midst of developing orientation videos to really give you a boots on the ground feel of what the AIM Center is like, including all of the candidate logistics and a walk through the center. And we'll be providing you with periodic updates. We will certainly be at every major national emergency medicine conference to answer questions about this. And as more information becomes available, we will be making sure that you have access to that information. Next. We truly do have a shared interest in this. You want to pass the exam, and ABEM wants you to pass. We want you to be successful in this. But you want your ABEM certification to have value and be valued by hospital systems and insurers and by the public. And that means that we do need a rigorous evaluation. Let's make sure that our interests align and that you are ready and feel ready for the exam. Next. We are here to support you. We're here to support you now, but we're also here to support you throughout your emergency medicine career. Once you become certified, you will have ABEM support as long as you are practicing emergency medicine. We are working to help promote to the public what your certification means and the value you bring to the emergency department and your community. Once you're certified, you can download the letter of support to forego merit badge requirements. The continuing certification requirements you will be doing supersede the need for such training and courses like ACLS and ATLS. We will be able to help you promote your certification. You can be provided with materials to share your ABEM certification status, including a board certified logo, press release templates to give your institutions, and more. We help you and support you to stay certified, to stay current and up to date with MyMCert modules and practice improvement opportunities. And we always encourage all of our diplomats to get involved. There are lots of volunteer opportunities. ABEM's work is 100% done by clinically active emergency physicians like you. So consider getting involved and helping to develop the future of the specialty. We're listening to your feedback and your questions. Next. So this is the central repository for all of the resources that I've discussed today. Check out our website, www.abem.org. So it's time for me to hand the floor over to you. The Q&A session is open. I encourage you to put questions in there, and I would be happy to answer those questions. Thank you.
Thank you, Diane. One of the questions we have is for residency program faculty. Will ABEM provide any other information or resources that can help faculty help their residents be prepared for this exam?
We are always looking for exactly what those resources that you would find most helpful may be as a program director. So please let us know what those are. We have been as transparent as we possibly can be in understanding giving you our scoring rubrics by telling you the major categories under which candidate would be scored. And I would hope that looking at the videos will give you a really good idea of what the actual sessions may look like. But if there are things that you as a program director feel you need or you want, reach out to us, ask us, and we'll have a conversation with you and see how close we can get to fulfilling those needs.
Another question that came in was actually about expanding the window for taking the qualifying exam. I certainly can answer that there are limitations from test center availability in terms of providing an adequate number of seats in order to be able to expand our exam window for the qualifying exam. And also, Diane, you may want to speak to what we learned during the Becoming Certified initiative and how residents weren't sure they wanted the exam earlier or an additional time just because it could interfere with the conclusion of their residency programs and needing to study. So there was a question about, can we expand the offerings of the qualifying exam?
Yeah, that would be a real change for ABEM if we offered the qualifying exam during residency training. The specter of that was brought up during the Becoming Certified initiative. The strongest voice against that was actually the resident voice, who said, gosh, we're really busy during residency. We want to focus on seeing patients clinically. We want to focus on really wringing every drop of education that we can out of our training programs. And we don't want the added burden of having a multiple choice question 305 item exam breathing down our neck. So we want that to be put off until we have a summer of real work underneath our belts. I would love to hear from this group if you think that that's not the case and that there's a big appetite for having the qualifying exam sooner. We wouldn't be the first nor the only board to do that, to place the qualifying exam actually in residency itself. But we really felt like during the Becoming Certified initiative, we had a good finger on the pulse of what residents wanted. And we heard loudly from them that they didn't want the qualifying exam during training.
Another question was about what ABEM has found in terms of knowledge gaps for what they found in the qualifying exam and certainly in the oral exam. And is there any information ABEM could provide about weaknesses or gaps in performance on either of those exams?
Certainly, when it comes to the qualifying exam and the oral exam, in the oral exam, as it currently stands, we are able to evaluate some interpersonal skills. but not nearly to the extent that we will be in the new certifying exam. About any real or perceived weaknesses, it's a great question when it comes to the certifying exam, because ABEM to this point in time has not directly assessed your all's performance in either procedures and ultrasound or truly bedside patient interaction skills. So will we find a significant gap between expectations and how residents are being prepared and leaving residency? We don't know the answer to that. But what we do know is that we owe it to the public to make sure that this skill set is verified.
Diane, another question is about the list of procedures and ultrasound. So what can candidates expect in terms of procedures? Is there going to be a list? And what can they expect for the ultrasound exam?
Yeah, it's a great question. For the list of general procedures, there's a comprehensive list in the ACGME key index procedures. Any of those procedures are really fair game to consider within the procedure testing. For ultrasound, again, the ACGME has a list of key ultrasound indications in emergency medicine. You won't be doing some of the niche exams for ultrasound. These are bread and butter ultrasound images and bread and butter ultrasound applications that will be included in the examination. I do want to take just a minute to weigh into the ultrasound issue, because there are usually some questions that come up there regarding, well, what if my ultrasound machine is different than the one at the ABEM's assessment center? The answer is that when you move to the ultrasound station in your assessment, you will get a clinical vignette. You will be asked what image you want to obtain and how you want to obtain that image. So what probe you want to use. And then when you are actually doing the scanning, we have an examiner in the room with you, where all that you have to ask the examiner is, can you change the depth? Can you change the gain? Can you change the mode of the ultrasound? And they will do all of the interface with the ultrasound machine. So it doesn't matter where the knobs are. It doesn't matter where the buttons are. What matters is that you know how to select a probe and you know how to communicate how to get a better image. And that you have the experience and the muscle memory to be able to get a good image and to be able to recognize what a good image is. And then to be able to interpret that image and images with of similar body parts with pathology.
There's a couple questions about attire. What should candidates be expecting to wear when coming to the certifying exam?
All we ask is you please come clothed. You can wear scrubs, you can wear tennis shoes, you can wear a white coat, you can wear a dress suit. You might get some ultrasound goop on it, just be aware of that. But ABEM does not, nor have we ever judged candidates based on what they wear. So we want you to be comfortable in what you're wearing for an assessment. And if that comfort means that you want to wear scrubs, you may wear scrubs. The only thing that we ask is that you don't have any branded scrubs that have your institution's logo on them anywhere. If you do show up in those, we're going to take a big piece of duct tape and tape right over them, because we don't want any of our examiners to be biased either for or against you based on where you're working. So unbranded work attire is perfectly fine.
There have been a couple questions about whether or not ABEM might consider or be willing to provide sample score sheets for the exams as a supplemental material to the scoring information on the website.
Yeah, so we are looking to getting you all a bit more information about the general scoring categories for each case. ABEM is moving to a little bit more of a holistic scoring rubric. The examiners are well-seasoned emergency physicians. They have gone through bias and fairness training. So it is not a checklist that we're moving from, but there are certain values for each of the cases. Those values have largely been messaged through the case descriptions where it says a competent candidate will be able to. And you can cross-reference that to the citations and the resources that have been used to really establish those values. But we will be giving certainly a sample of the general categories and the way that we are able to share as much scoring as we can with you, we will certainly do in the future.
Diane, can you speak to ABEM and the relationship to the societies such as ASAP, AAM, and CORD in terms of board preparation? So I think there's been a number of questions about, is someone going to offer a prep course? Is someone going to offer online resources, et cetera? And I wonder if you want to speak to the work that we're doing, working with those organizations to help provide and build those types of resources to help residents and candidates prepare for this exam.
Yeah, it's a great question. A number of national emergency medicine organizations have traditionally had prep courses for the oral exam, and I know that they are looking to develop those. ABEM is being as transparent as we possibly can and as engaged as we possibly can with many national emergency medicine organizations to give them that information so that they can develop a prep course. You can imagine as the testing organization, I can't recommend any one of those prep courses over another. But most of the major EM organizations have actually been to Raleigh. They've toured the center. They understand the specifics of the case types that we're giving and what we're looking to assess within those case types. And I think the question about like a timeline for that and when they might have further course development or course information online is better asked to those national organizations. But ABEM is cooperating with them. We speak with them freely, and we are freely offering as much information as we possibly can.
So there are a couple questions about scoring. And, really what is meant by criterion referenced and, is ABEM, if it's criterion referenced, is ABEM really considering like a 50% fail rate? I mean, in terms of just thinking about, how that score is set, that it's, represents the emergency physician, in terms of their practice. And also then if you could also address how we mitigate against bias in those exams as well. But some concerns and questions about, it's a new exam and, concerns around a high fail rate with it.
That's not our goal. Our goal is not to have a 50% fail rate. I will tell you, I will promise you right now, there will not be a 50% fail rate. We are benchmarking you all as a cohort against emergency physicians that are currently practicing. There is no way that 50% of you have not met the standard of the class in front of you that just graduated from a residency and are now board certified because they just went through the certification process. That is the cohort that you're being compared to. Are there mitigating factors in your training? Were you trained during COVID? Are the patient populations in the emergency department changing? We're not comparing you to people that have been practicing for 40 years. We're not comparing you to a cardiologist or to a critical care physician. We are comparing you to the competent emergency physician who is out there working in the emergency department and seeing patients. That is what criterion referencing means. And that's the group that you'll be compared to. But we are assessing new competencies, and it will be very important for us to understand what those competencies are benchmarked at in the general community. It's going to be really important for us to know how are competent emergency physicians who are practicing independently managing airways or managing conflict or managing delivering bad news. We are not comparing you again to communication specialists or to pain and palliative care physicians. We are comparing you to emergency physicians. Kathleen, I'm sorry, in my rant, I forgot the second half of the question, which was?
Bias, mitigating
Oh, bias.
bias.
How are we
and
mitigating
testing
bias?
and testing fairness.
Yeah, so thank you. We are we're doing that on a micro level with each case developer and with each examiner, and we're also doing it on a macro level. So we understand that there is the potential for bias in all of us and in all of our evaluators, all of our examiners, and all of our case developers. We have an entire panel of diverse emergency physicians that are looking at cases and their potential for bias before they're even put into the queue and considered as testing material. Each case developer and each examiner goes through bias and fairness training. And most importantly is the opportunity after we start getting data from exams and after we start looking at multiple examiner evaluations of the same candidate to see if there are disparities in that and to be able to take a sampling of the cases and run them through independent evaluations to make sure that scores line up and that there is general agreement on a candidate's performance for any given task within the exam.
There's also a question about how we're going to handle disability issues, especially if you have a candidate who may have documented visual impairment, things like that, and how those ADA accommodations will be accommodated, and we will actually likely have a modified schedule for them that provides that equipment, and that's something that ABEM recognizes that we will be providing as part of this exam. Another question is about the fidelity of the procedural equipment and what's expected, what is that, what should be programs be aware of in terms of the procedural equipment itself.
Yeah, these are we are keep in mind we have 3,500 candidates to evaluate in a year. That's a lot of candidates. So we are not talking about a simulation, a high fidelity simulation model. We're not looking at MediMen or $1 million assessment tools. The skills and the procedures that we are assessing are done with kind of run-of-the-mill task trainers that are available in almost every simulation setting across the nation. So it's not the bells and whistles that we're looking for. It's kind of basic emergency medicine skills and things that I would guarantee every residency training program either does or should have access to in a simulation setting.
In our remaining minutes, there are a couple of questions about whether or not a residency program faculty can participate as mock candidates. And that was something that I think we saw as a question that, I don't know, Diane, if you want to comment on us in terms of possibly providing that as an opportunity.
Yeah, it's you all are cutting edge. Literally, that question came across my computer yesterday for the first time, and it's something that we hadn't considered. So we are bringing it to the Certifying Exam Working Group tomorrow during our meeting. And I think it's an intriguing question. We don't want to be opaque in the way that we are preparing folks for this exam. I would be interested to see, so keep in mind, all of the case demonstration videos dropped either last week or the week before. So those are kind of brand new on the internet. I would be interested to see the opinion after people go through those videos and see what they're like, if actually there's the same appetite for program directors to come to the AIM Center and go through the experience. We want to hear from you. If that's the case, if the videos aren't giving you that level of fidelity that you need to feel comfortable about what the cases are like, then I think that we should have that conversation with program directors. We want to give you all the tools that you feel you need to make sure that your residents are successfully prepared.
Yeah, there were a couple questions on costs, and I would encourage folks to go to the website. All the costs for the exams, and we are currently looking at, negotiating hotel rates for candidates to keep those rates low. There was questions about candidate scheduling, and that is something we will be looking at and working on to see if we can build a little bit more flexibility in terms of candidate scheduling this year, recognizing we do need randomization because not every residency program can come the same week. So we are going to try to create that balance and give some autonomy to the residents to be candidates, to go to that exam. But with that, and we would encourage folks who have additional questions to send them to qualify@abem.org. And we will be happy to answer those questions along the way. But I'd like to turn it over to Diane for any last comments.
Well, again, thank you for joining us, whether it's synchronously or asynchronously. Your questions, it's really our goal to be able to answer those questions and to give you as much information as we can. So thank you for your attention. We look forward to seeing you in Raleigh or hearing from you online ahead of time, and have a great day, everybody.